Have you ever woken up after a good night's sleep, only to find your knees or shoulders feeling a bit creaky and reluctant to move? That sensation, often described as morning joint stiffness, is incredibly common, and it can leave many of us wondering, is this just a normal part of aging or something else entirely? Morning joint stiffness most commonly means that your synovial fluid, the natural lubricating fluid within your joints, has settled and become thicker during periods of inactivity. This leads to that temporary, slightly restricted feeling as you begin to move. For many, it is a benign phenomenon that quickly resolves with a few minutes of activity. The primary reason for this temporary stiffness lies in the composition of your synovial fluid. Think of it like motor oil. When it is cold and still, it is thicker, but as the engine runs and warms up, the oil becomes more fluid and effective. Similarly, during rest, your joints are not actively pumping and circulating this fluid, allowing it to lose some of its lubricating efficiency. As you start to move, your body naturally warms up, and the mechanical action of joint movement thins the synovial fluid, restoring its slick, cushioning properties. However, if stiffness persists for a longer duration, say beyond 30 minutes, or is accompanied by pain, swelling, or redness, it might indicate an underlying inflammatory process or joint condition, which is a key distinction to understand. To address common morning stiffness, a gentle approach is often best. Start your day with some slow, deliberate movements like simple stretches or range of motion exercises. Hydration plays a surprisingly important role, as being well hydrated helps maintain the optimal consistency of your synovial fluid. Listening to your body is crucial. If the stiffness eases quickly and does not return with activity, it is likely just normal joint sluggishness. If it lingers, worsens, or is consistently painful, that is your signal to consider speaking with a healthcare professional for guidance. A fascinating detail about joint health is the concept of cartilage nutrition. Our joint cartilage, the smooth tissue covering bone ends, does not have its own blood supply. Instead, it relies on the movement of synovial fluid to deliver nutrients and remove waste products. This process, known as imbibition, highlights why regular, gentle movement is so vital for maintaining healthy, flexible joints. It is not just about lubrication, it is about feeding your joints. Conditions like osteoarthritis, for instance, often involve a breakdown of this cartilage, leading to more persistent and painful stiffness, especially after rest. Understanding the difference between benign morning stiffness and a more concerning signal empowers you to proactively care for your joints. By recognizing that some stiffness is normal and temporary, while persistent discomfort warrants attention, you can make informed choices to support your athletic performance and overall well-being, keeping your body moving freely and comfortably for years to come.